Hi Steph, how are you?
I'm good. How are you?
Pretty good. Thank you for being here today with us.
No problem.
You're awesome, of course, as a patient. I love you and I'll miss you. So she's gonna be leaving soon, but things are looking really, really, really good for her. But tell us a little bit about how you met Dr. Marzban and how do you find her and what makes you come?
So I moved to the DC area and had been dealing with TMJ for a couple of years. I started looking online, trying to find a TMJ specialist. My symptoms kept getting worse. Thought it was time. I tried to find someone who was well recognized and knew what to do with TMJ. Found Dr. Marzban, started doing a little more research on her through her website, through other websites, saw that she was very well recognized in the TMJ area. Called up, made an appointment, came for a consultation, and I was told pretty much from the beginning exactly what the treatment plan would be. So I was very comfortable knowing exactly what the treatment plan was going to be, how long it was going to be. They told me very early on I was going to need braces to make sure I was okay with that. And so I felt comfortable knowing what I was going to have to do right from the start, so I wasn't going to be wasting my time with anything that I wasn't comfortable with.
How do you know you had TMJ?
I was diagnosed prior to coming down here from another TMJ specialist in Connecticut. I had been dealing with a lot of symptoms, went to an ear, nose, and throat doctor, and he was the one who said I probably have TMJ, referred me to her. She diagnosed me pretty much immediately from the office. Started treatment with her, and then things happened. I had to move down here, so I didn't never finish my treatment with her.
What did she do different than what we did for you?
I had an orthotic with her. It wasn't quite the same as the one I had here. It wasn't molded for my teeth. It was basically just to help me from not grinding my teeth quite as much. She had me do a couple exercises to stretch my muscle and my jaw out, which helped alleviate some of the pain. And she gave me some pain shots to help with neck pain and things like that.
Where do you get these pain shots?
In the back of my neck, shoulder, pretty much anywhere along where I had pain. She tried to find the worst point and go ahead and give me the shot there.
So we started treatment in April. We met first in March. Then we started treatment in April of last year, 2015. So it's roughly a year and a half. How long before? So this treatment that you were undergoing in Connecticut, you said it was helpful, but what was different than what you started experiencing with the neuromuscular therapy Dr. Marzban started for you?
Hers was definitely more pinpointed towards exactly what was wrong. The treatment I was undergoing in Connecticut made it bearable to kind of go through everyday life. I was still experiencing all the symptoms I had. It was just I could get up and go to work and function a little bit better. Once I came down here, though, after maybe 2 months of treatment, I just felt like a completely different person. It was more targeted towards fixing what was wrong instead of just making it bearable to do my everyday tasks.
Tell me, I mean, nobody likes to remember what they felt like, but just tell me just a little bit. What were those symptoms? How bad they were that they were affecting your quality of life?
So I pretty much had all the telltale signs of TMJ. I grinded my teeth for as long as I can remember. I kind of woke up one day and had really bad headache, pressure in my ears, pain in my jaw, neck pain, shoulder pain, primarily on my right side. And it just got so bad, I thought I had a sinus infection. Went to the doctor, did antibiotics.
You saw an ENT too, I remember you said that.
Went to him, we kind of thought it was the same thing. I had just been on a trip, and so we thought maybe I picked something up in the airplane or something like that.
Scuba diving.
I did scuba diving, so we thought maybe that was part of the problem with the ears. Went back to see him after maybe a month when things weren't getting any better, and he said, I think you have TMJ, referred me to a specialist, and like I said, she pinpointed it within 10 minutes of my visit with her. But I had symptoms. I couldn't even put my head down on a pillow some days. The pressure was just so intense, and it was unbearable to really do anything.
And you don't like taking medication, so medication was not an option for you.
Yeah, I tried taking Advil and things like that. It just wasn't helping anything. I tried pretty much everything over the counter that I could. Ear drops, all that kind of stuff to try to help with that, and nothing helped at all.
Yeah, you know, the good thing about this part of it is like you almost done. You finished your orthotic therapy, and now you embrace this, okay, which you knew that, and you smile all the time. You know, people would think that when I tell them what they're gonna go through, that I have 3 heads, and that's impossible to deal with, and you're in front of people all the time. Your work at, you know, with law enforcement, and the fact that you were in so much pain, you just like, what made you go with this?
Yeah, it just got to the point where I was tired of feeling bad every single day, and I thought, especially being down in the DC area, there has to be someone who has knowledge of TMJ and would know what I could do to alleviate. You know, someone had suggested in the past surgery. It wasn't really an option for me. Did some research on it on my own, found out it's really not all that successful. I talked to a couple people who had it done as kids, and it was miserable for them, and they never really fixed the problem. So that I eliminated that pretty much when I was looking. Anyone who said surgery for it just wasn't an option for me. And after doing my research, I didn't think that was the best solution given the history of it's only maybe 50% successful from what I saw. And it just wasn't worth going through for me.
Right. What do you think of that piece of plastic that we gave you? I mean, because that's what it looks like. It's not an eye guard. It's a dental appliance. It's an oral appliance, but it's made out of acrylic. And
I hated it. I had one in the past, so I think it was a little easier for me to deal with. Talking, you know, in the beginning, most people have a lisp. You probably spit a little bit more than usual. I hated having it. I couldn't wait to get it out. But like I said, after about 2 months of having it in, it was just a crazy transformation of how I felt. The first week or so was miserable because everything was going back into place. You know, I had a headache. It didn't go away right away because everything was trying to get back into the right spot. And, you know, you can't eat a lot of foods, certain foods. It takes a lot of care. You know, you have to brush it every day and things like that. You have to take care of it. But as I said, everyone here told me, you know, if you follow these rules with it, you're going to be successful and you're going to feel better. And ultimately, yes, not being able to eat certain things and having a lisp for a couple weeks till you get used to it.
Yeah,
it's
better to deal with it than pain.
But, you know, I followed what I was supposed to do, and I think, relatively speaking, I've moved pretty quickly through the process just by following what they told me to do. So, bear with it. Just get used to it, deal with it. You know, I wore it all day, every day, and there were days that I didn't want it in, but it gets a little easier along the way. It gets smaller and less noticeable. Most people couldn't notice it. They had no idea I had anything in. And same with the braces. Most people don't notice them. You can't really see them until you get close up. So I was a little self-conscious about the idea of it and about getting them, but like I said, most people don't even notice.
And you're so young. Imagine, you know, people that are dealing with this, with medications and for years, and the fact that you're so lucky that you happen to believe in yourself, trust yourself to do this is the right thing for you, and get it done, get it out of the way, and you're gonna be happy for a long time with no symptoms forever, as long as you live. And yeah, that's awesome, Steph. Thank you so much. Thank you for being here and sharing this happiness with us. Your success is our success, and we can't wait to hear more from you.
Yes.
Personal.
I want to thank Dr. Marzban and everyone here. I really do appreciate. I wasn't 100% on board when I got here, just because I had failed the first time, and so I wasn't. 100% sure how it would go, but after they talked everything through and said, here's your treatment plan, I felt a lot more comfortable to go ahead and dive in and, try to get better. So thank you.
Our pleasure.